Hello everybody, we're a student from Miami Regional University and now we're going to present the assessment, and in my case I want to do head and neck assessment. The first thing we have to do with the patient is to observe the head position. It has to be upright, midline. We have to inspect the facial features, especially you have to check the shape, especially the eyelids, the eyebrows, the palpebral features, and the nasolabial folds. Also, we have to check the mouth. Please, can you smile, please? Thank you. Can you show me the teeth? Thank you. Can you puff the cheeks? Thank you. There is some variations according to the race and the sex and the age also. But in that phase, we're changing the symmetry. It's a very symmetric phase. Inspecting the skull and the scalp, we have to consider that the size and the shape as any asymmetry. We have to check the hair from the front to the back, and the hair pattern. We have to pay special attention behind the hairs at the hairline and the crown, and we expect, by temporal recession and or balding area in the crown area in men's. In that case, it's okay go there. Now we have to check for the lymph nodes. Inspect the lymph nodes if there is any visible nodes. Salivary glands also. And now palpation. We have to palpate the head and the scalp. Basically, we have to palpate in the gentle area with the pass of the fingers. The finger, if there is any bumps, any prominence that from the front to the back. We have to palpate the hair, the texture, the color distribution, and also we have to palpate the lymph node. Can you turn the head now? Okay. Now in the lymph node we have to check different nodes, the location of the nodes. Basically, we have to palpate with the pads of the second, third, and fourth finger, and we have to palpate the occipital nodes. It's in the base of the skull. Post-auricular nodes is in the mastoid, in the mastoid process. Pre-auricular nodes is in the front of the ear. Also, we have the parotid and retropharyngeal nodes. Is in the angle of the mandible. Some mandible nodes is between the angle and tip of the mandible. Some mental nodes is important. Here you have to palpate in that way, but you have to find out if there is any lymph node enlarged. After that, we have to palpate the temporal arteries. Please, thank you. We have to do it here with the fingers and in that area. Also, an important part in the palpation is the TMJ, temporomandibular joint. Temporomandibular joint is important that, can you open the mouth, please? And you have to put the fingers in the space of the joint and check if there is any crack or any problems in that. Regarding the neck, we have to inspect the neck. And most important, we have to check in slight hypertension, and also the landmarks of the triangles, the anterior triangles. When the first landmark is important is the anterior border of sternocleidomastoid, and we have to check the trachea. The trachea we have to put it, the finger here. Can you swallow, please? Thank you so much. And also, we have to evaluate the range of motion of the neck. We have to flex, to extend, to rotate, and laterally, turn the head and then the neck. Also, in the trachea, we have to put the fingers in that area, and also we have to palpate in the neck the thyroid gland. Thyroid gland, there is two different ways to palpate the thyroid gland. There is an anterior that we have to fix. We have to fix in the opposite side, and you have to palpate with the fingers in one side. Posterior assessment for the thyroid. we have to put the, can you hear? Excellent. We have to put the finger pads in between the, you know, we have to check the landmarks, and we have to check the trachea, and you have to, we can search, there is enlargement of the lobes. When you palpate the nodes in the neck, you have to check the superficial cervical nodes, the superficial cervical nodes, yes, and the posterior cervical nodes and the deep cervical node. A special mention, we have to check in the supraclavicular area. We have to check that there is any nodal enlargement, no lymph node enlargement. You know, it's a probability that, you know, we can suspect that malignancy over there. The last part of the assessment in head and neck, we have to auscultate the temporal arteries. There is any bruit over there, and bruit, there's no bruit in that. And the temporal arteries. Also, we have to check the carotid artery. The carotid artery, if there is any bruit in that, of course, it's better check with ultrasound. And also, we can, when there is an enlargement on the thyroid, there is or in hypothyroidism, we can feel or listen a bruit in the thyroid area.
I come to see your eyes. The first time, I check your vision. Your vision in the far away. I need to use the Snellen chart. The Snellen chart. Can you see there, please? Close your left with your eye, your left hand. Okay. The last. Can you see your last lane?
Yes, I do.
Okay. Open your other eyes. Reading your last lane.
Yeah.
Can you see?
Yeah, I do.
Okay. Good. Your vision is very good. Now I need to check your vision for near. This is the Jagger chart. The Jagger chart. Can you see there, this lane?
Yeah, I do.
Okay. You have the good vision, near vision. And now I provide you confrontation test for I need to explore, please. Look my eyes. Close your left eye with your hand, please. Okay. I move look at me, please. Tell me when you see my finger.
Okay, I'm going to begin inspect your ear, the auricle, and some rise areas, looking for size, shape, and symmetry. Okay. I palpate the size and mastoid area for tender, pain, or swelling. You don't feel pain.
No, nothing.
Okay. I inspect the auditory canal, the tympani auditory canal, with a stethoscope. In this time, I'm going to do inspect the meatus and to tympanic member for some discharge, for some lesion, color, and other alteration. Okay, I'm going to see in this. Okay, it's okay. Now the access the hearing evaluation. Respond one question during the interview. You hear me well? No?
Yeah, I'm listening.
Okay. Respond one. I whisper my voice. 3MI.
3MI.
Okay. Okay. I'm going to whisper now. JKL.
JKL.
Okay. It's so good. The other evaluation is with tuning fork for weather test and hearing test. Okay. In this case, tell me when you don't hear the sound.
No.
Tell me now.
No.
Okay. Now I want to inspect for noise. Noise. Okay. And in this case, I inspect the external noise for alteration in size, shape, and other color or noise. Okay. Take out the glasses, please. Okay. Thank you. Okay. I palpate some alteration, some nodules, some masses, lesion. No tenders. It's okay. 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 Go back there. In this case, I'm going to inspect for pathway of the nares. Okay. Okay. At this time, I didn't see any discharge, any lesion, any change the color, alteration. Okay. It's okay. In this case, I inspect the mucus, and the mucus is pink, red, and moist. Now I'm going to inspect the mouth and oropharynx. In this case, I'm going to inspect your lip for shape, for symmetric, for alteration, color, and palpate the symmetry and any alteration. In this case, you don't have tender in any lip. Huh? Okay. And now I want to inspect the oral tract. Please smile. Smile. Okay. I want to see the teeth. No alteration, no missing the teeth. It's in good shape. And the other, I want to see the buccal mucosa. In this case, I ask you, please open the mouth. Okay. Open the mouth, and I put the tongue blade, and I see the oral mucosa, and have the pink color, red, and no alteration, and I saw the gum for shape and some discharge or some lesion. Now I'm going to inspect the oropharynx tonsillar pillar. In this case, please open the mouth. Say ah. Okay, okay. In this case, I saw that no alteration, have the red color, and no mass, no lesion. Now I'm going to inspect for gas reflection. The gag reflex is open the mouth and touch I'm sorry, touch the posterior wall pharynx and everything okay.
Now I'm going to show you how to examine the peripheral artery pulses. I'm going to start with the carotid artery pulse. We check here from the clavicle to the sternocleidomastoid, where the sternocleidomastoid muscle start, right here. And then following that line, you can palpate here. Or in the other side, like this. Once you finish with the carotid artery pulse, then you can go to check the brachial artery pulse, which is in here. Then after that, you can go to the radial pulse right here. And after you check the radial pulse, then you go to the saving the privacy of the patient to the femoral artery. And then you can get the femoral artery pulse here. Once I have finished with the carotid, brachial, and radial, and femoral pulse, then I go to the posterior popliteal pulse right here. When it is present, then I go to the posterior pedial pulse right here. And the last one will be right here, the posterior pedi pulse.
My name is Alejandro Oliveros. I'm going to assess cardiovascular system. In this case, I'm going to focus in the precordial area. The first thing we need to do with the patient is ask a few questions of the patient. For example, we can ask the patient if he have any cardiovascular disease, any chronic condition regarding this system. Do you have any chronic condition like high blood pressure, heart attack, or ischemic cardiopathy?
Yes, I'm hypertensive.
Okay. Once we do a few questions, we can proceed to assess the system. The first thing we need to do is inspection. The inspection is upon some resource. For example, we can find some leaf in the precordial area. We can find some abnormality in the precordial area or in the thorax, or even we can find some dilation of veins or some alteration, abnormality in the precordial area. The second thing we can do is the palpation. Palpation is a very important part of this procedure because we can find the different expression of the murmur or thrill. For example, we can start for the second intercostal space. In this case, we are going to start the right side, left side. And one important thing is to locate the point of the maximal impulse of the heart. In this case, it's in the fifth intercostal space, in the mid-clavicular line, and we can put very gently, like the 3 fingers in here, and we can feel the maximum impulse. If you feel more than the fifth intercostal space, we can suspect some enlargement of the heart or some abnormality, hypertrophy of the left ventricular or something like that. The other thing we can do after the palpation is the percussion. Percussion is limited because don't afford not too much resource. In this case, we prefer to figure out the enlargement of the heart by radiologists study. But we can try percussion the area starting in the anterior axillary line toward to the sternum, like this. Okay. The next step is the auscultation. Is the most important part of this assessment, and we can start for sorry, to auscultate the aortic valve or aortic area. After we can assess the pulmonic area, tricuspid area, mitral area, and air point. Starting with the diaphragm of the stethoscope to find the high-pitch sounds. Second intercostal space, the left side. Second intercostal space, the right side. Fourth intercostal space, right side, the sternum. And finally, fifth intercostal space, and the air point in the third intercostal space, the right side. And also, we can auscultate axillary area looking for some murmur. Okay. Once we finish with this part of the diaphragm, we can auscultate with the bell to find the low pitch sound. Same procedure. Second intercostal space for aortic valve, the right side. Second intercostal space, left side to the pulmonic area, tricuspid, mitral. Okay? So, once we finish the whole assessment, we can expect some finding and make the history of the patient.